Please repeat after me. Early detection is the best protection.
Early detection is the best protection.
This is the phrase that many people in the United States today recite as they march, walk, and stand up for a cure for breast cancer. Did you know that 1 in every 8 women and 1,400 men will be diagnosed with breast cancer in their lifetime? AboutWomen.com reported those statistics along with a few others, such as every 13 minutes a woman dies of breast cancer. So in saying this, my thesis is that yearly breast exams and monthly self-check exams can help detect breast cancer early and have a better turnout in becoming healthy again. Seeing breast cancer as an overview would involve symptoms, types, causes, and treatment. There are 2 main types of breast cancer, ductal carcinoma and lobular carcinoma. Many of the questions about breast cancer involve these questions. The symptoms vary from people depending on their age, gender, or race. Women's breast cancer is the most regular type of breast cancer, but the symptoms are different in every case. In most women, the symptoms consist of lumps in the breast or armpit area. These lumps usually are hard and have uneven edges and usually do not hurt. Other symptoms are change in size, shape, or feel of the breast or nipple. Another symptom is fluid coming from the nipple. This fluid may be bloody, clear to yellow or green, and look like pus. It is uncommon for men to be diagnosed with breast cancer. According to statistics, 1,400 cases of breast cancer are men, and 400 of those men will die. The symptoms of breast cancer are very basic and include a breast lump and breast pain and tenderness. There are also specific symptoms that pertain to people with advanced breast cancer. These symptoms are more serious and more noticeable. Many with advanced breast cancer may experience bone and breast pain and discomfort. Skin ulcers, swelling of one arm next to the breast with cancer, and weight loss are also signs of advanced breast cancer. There are many risk factors and causes of breast cancer. Many of these factors can be changed, but others are coded in our genes. Several of the risk factors that cannot be changed include age and gender, family history of breast cancer, genes, and menstrual cycle. Many people are unaware of the fact that your risk of developing breast cancer increases with age. Most advanced breast cancer cases are found in women over the age of 50, and women are 100% more likely to get breast cancer than men. You are also at a very high risk if you have a close relative who has had breast cancer, urine, ovarian, or colon cancer. 20 to 30% of all women who have had breast cancer have a family history of the disease. Genes also play a huge part of a person's chance of developing breast cancer. There are 2 genes that normally protect a person from cancer, BRCA1 and BRCA2. But when a parent passes a defective gene to their offspring, that child has an increased risk of developing breast cancer. Women who have been passed this gene have up to an 80% chance of getting breast cancer sometime during their lifetime. As strange as it sounds, a woman's menstrual cycle can be cause of breast cancer. If a woman begins her menstrual cycle early, before the age of 12, or has gone through menopause late, after the age of 55, she has an increased risk for breast cancer. On the other hand, there are many risks that can be changed. Many of these risk factors include alcohol use, childbirth, DES, hormone replacement therapy, obesity, the use of oral contraceptives, and radiation. It is a proven fact that drinking more than 1 to 2 glasses of alcohol per day may increase your risk of developing breast cancer. Putting off or deciding not to have children can increase your risk of breast cancer. If a woman decides not to have children or to wait until after she turns 30, this increases her risk for breast cancer. But on the other hand, having children at an early age or having multiple children reduces the risk for having breast cancer. A drug, DES, or disulfurate, which was given in the 1940s to the 1960s to prevent miscarriage, may increase the risk of breast cancer. Many women take hormone replacement therapy, HRT, to reduce the symptoms of menopause. It is now thought that HRT puts women at a higher risk for breast cancer. Studies have shown that obesity can be linked to causing breast cancer. In these studies, the theory is that obese women produce more estrogen, which can cause the development of breast cancer to form. Many people are unaware that the use of oral contraceptives can slightly raise the risk for a woman to develop breast cancer. Radiation treatments have been known to cause breast cancer, especially if it was given to a young child for cancer in the chest area and the child's breasts were just beginning to develop. Treatment for breast cancer depends on the stage and type of cancer that you have. In most cases, the following treatments are used: chemotherapy, radiation, and surgery. There are other treatments such as hormone therapy and targeted therapy. As I stated before, early detection is the best protection. This includes yearly and monthly breast exams and making little changes to your lifestyle that will help prevent breast cancer. There are many tests and exams that may be performed. Such tests include mammograms, breast MRIs, breast ultrasound, breast biopsy, CT scans, sentinel lymph node biopsy, and a PET scan. The American Cancer Society has recommended that women get exams ever so often depending on their age, so they have created the Breast Cancer Screening Guide. They recommend that age 40 and over should have mammograms and clinical breast exams yearly. For those in their 20s and 30s, a clinical breast exam about every 3 years is appropriate, and starting in their 20s should do monthly self-check exams. Once a doctor has determined if breast cancer is present, he or she will discuss with you your options. First, you will need additional tests done to determine whether or not the cancer is spread. This is called staging. Breast cancer comes in many stages, and they range from 0 to 4. The higher the number, the more advanced cancer is. If the breast cancer has not yet spread, it is called ductal carcinoma in situ, more commonly known as DCIS, or non-invasive breast cancer. However, if the cancer spreads, it is referred to as invasive breast cancer. Prevention is a very important tool when discussing breast cancer. Researchers believe that there are many things that can be done to lower your risk of obtaining breast cancer. For instance, maintaining a healthy diet and lifestyle. As strange as it sounds, having children can lower your risk. Researchers believe that having multiple children lowers your number of menstrual cycles in your lifetime, and that has an effect on breast cancer. Alcohol consumption has been clearly linked to causing cancer. Women who have 2 to 5 drinks per day are 1.5 times more likely to develop breast cancer, as well as other cancers such as mouth, throat, esophagus, and liver cancer. It is important to maintain a healthy diet to prevent becoming overweight or obese. Obesity puts a person at a higher risk for developing breast cancer, especially if that person has already went through menopause. This is caused when fat tissue makes estrogen. When you're overweight, it raises your body's level of estrogen too high. In a recent study, researchers have found that brisk walking helps to lower a woman's risk of developing breast cancer. The American Cancer Society has found that as little as 1 1/4 to 2 1/2 hours per week of brisk walking lowers a woman's chances of developing breast cancer by 18%. As I've stated many times, the key to a healthy life is to abide by this one saying: early detection is the best protection. Breast cancer consumes thousands of lives each year, and you're no different, no matter your age, gender, or race. So please follow the guidelines that the American Cancer Society has formulated for your health. A lot of this information may be a little confusing to take in all at once. So if you have any personal questions, I recommend that you speak with your doctor because no woman's risk factors are the same.